The Ministry of Health and Sanitation continue for give status update for the COVID-19 at the country. Sierra Network Day at the National Emergency Operations Center concerning the update. Let we listen to the official chairperson for the COVID-19 at the country as they can give a more updates.
Good morning, everybody. Welcome to the daily press update live from EOC in Freetown. You can get us live at MIC Facebook, SLBC Channel 31, and AYB Channel 33. And you can also get us at SLBC's Facebook, Channel 33 Live. Channel 31, SLBC Facebook, Channel 31. We'll start the updates by asking the official spokesperson, the Honorable Solomon Jamiu, to make the press statement. Over to you, sir.
Thank you very much, Harold, and it's my pleasure to acknowledge the presence of the outgoing and current president of the Sierra Leone Association of Journalists. I believe that they are doing so much in complementing the efforts of the COVID-19 national response, and by extension helping the people of Sierra Leone to get the right education and to help in widening and deepening outreach around COVID-19. Friends, we also have with us Dr. Vandy, who will be speaking. Dr. Vandy is on the surveillance pillar, and as well as Honorable Haji Keller on psychosocial. So once we have questions or concerns relating to those pillars, they will be very pleased to respond to those concerns or questions. Status update for COVID-19, 24th April 2020. Total cumulative confirmed positive cases, 82. Total number of deaths, 2. Active new cases, 18. Active cases at isolation centers, 70. General condition of confirmed cases, stable. Cumulative recoveries, 10. Number currently in quarantine, 891. Number discharged from quarantine.
I will ask everybody to put your mic on mute, please. Please mute your mic. Admin, can you mute the mic from here? Okay.
Yeah.
So I will do that one more time. Total cumulative confirmed positive cases, 82. Total number of deaths, 2. Active new cases, 18. Active cases at isolation centers, 70. General condition of confirmed cases, stable. Cumulative recoveries, 10. Number currently in quarantine, 891. Number discharged from quarantine, 1,259. We continue to commend Sierra Leoneans for complying with the health guidelines, with the tips, and we believe that we should continue and deepen this, and we believe that together we can win the fight against COVID-19. Over to you, Harold.
Hello, welcome to this interview. Your name and that you be?
Harold Thomas, Health Education Program Manager and Communication Lead at the Ministry of Health and Sanitation.
Okay, as we see Salodo record to death, and I go on to make you tell we about then death there, so if the stats and treatment at the different hospitals there.
Yeah, unfortunately, then 2 deaths and day, one occur at Connaught Hospital and the other one at Choitram Hospital. But the reason why they been going are for other causes. But because of the good, experience of the medical team, both na Connaught and Choitram, then suspected them people and they go get COVID. So they order the test. So for Connaught, they order the test and do the test, but unfortunately the person passed off before the test results they come. And then we don't put on the temporary isolation where they get a Connaught Hospital. So which means and not put the other people at risk. And the medical team within a Connaught Hospital been not suspect, so then take universal precaution. The same applies to Choitam Hospital. Choitam also, now the same thing they do, but the test results actually come out before the patient being passed away. But unfortunately, by the time they transport these patients, then they transfer them from Choitam Hospital for going to the treatment facility, now the patients pass away.
So let me look at the one at Choitam Hospital. When it be good for treatment?
Well, now 2 days ago, but I'm not going to give you the fine details now. But that ain't happen. You know, it go, but it take a very short while, and you know, because of other conditions that we get, and because of his age, you know, the patient may pass away, and he not be able to go at the treatment center in time. It go for other reasons at the hospital.
So as soon as I get the surveillance team, I want to make we know if you like them, we don't start any treatment on that patient's day before they find out say it show any signs and symptoms of COVID-19.
Yes, as they say, they go to the hospital for other conditions, but the judgment of the medical team is so sharp that they suspect straight away say this patient could likely be COVID patient. So now that means they order the test and then put on a temporary isolation. And waiting them in suspect, exactly now that the test result also be revealed. You know, and as I say, shortly afterward, the patient died, the Connaught patient, before the results come in. But for the Choitam patient, it been die after the results don't come out. That may be warrant them for transfer now the treatment facility, but unfortunately, the patient not be able to make them.
So for the Choitam Hospital, we get for see any quarantine?
If the medical staff then they be observe universal precaution and they be no say the patient they come and then take all necessary precaution, then quarantine not go happen. Quarantine go only happen if the staff they don't know say na COVID patient and then drop them guard, they not use do universal precaution. Now that make we tell all health workers at this stage say now because of this outbreak you get for observe universal precaution. The IPC methods where they do your PPs and everything you for do them, so that if any case once you observe the formalities and there's no need for quarantining.
So this COVID-19 test, and for put some part of the other sicknesses them like we person go to hospital and supposed for doing test. As we see then 2 patients there also don't die from different hospital, not from the treatment center.
No, the protocol not call for that. We not dey test anybody we go. But the case definition where if you meet the case definition, if they show then signs and symptoms and they definitely then go suspect say you get them. And the best thing where you go to any health facility, they not go turn you back, say go home. Then we'll get temporary isolation place where you go daily, done, then go do the test, and if you're positive, then call for the ambulance and carry you go to the treatment facility. But the staff them then go take strict precaution for protect themselves and other patients them and even the patients as well.
And also we see some side and right now where the COVID-19 don't they extend or we don't see the case they don't begin to come out today. I go want for know what in the ministry don't decide for do to the side and they.
Any side will get COVID case, the best we can do at this time is for do the surveillance team they go there and do a comprehensive line list and we do quarantine and we make sure say we pick out all the contacts them. We monitor them contacts and if any case they we pull them out. The important thing is we want to interrupt the transmission of the virus or break the chain of transmission. That's the surveillance team that they do. You know, any sideway case you find out say we go there and look at a list and all that list and we follow up them and we find out say you see the cases and where they come more than one. The reason is, at the end of the 14 days of quarantine, well now we don't extend them more than 14 days, but when we reach 14 days, then we test all. For instance, if 100 people have been in quarantine for commodity, then they test all. So when they test all, whether they're sick or they're not sick, when the results come out, if we get positive case, we pull them positive cases and then that make we see say we get cases them in a row. But some of them case they don't mean to say they're sick, but we see say they get the virus where they cause COVID-19 and we will pull them out. We're in a very good strategy. And make you find out say we not get too many, patients and we're very, very ill patients there. Some are mild symptoms and get some not they show any sign at all. But the test they prove say they get COVID. So now that's make we do. And so that's one of the best strategy we ever they do. So the numbers will be alarming. But all of this, when I find out say nowadays we get recoveries, almost regularly. Meaning people then they recover because the test don't show say they get an early, then we're able to take measures early and then we're able to come out again early. So this is a message to the public, make whenever they want to do the test or let you cooperate with the surveillance people and so that they go save your life. Now we imagine say them people and they always don't come out, so then 10 people and they they're not been going time or they're not been give for go at the health facility, they're not for them get this good success story where then they come out back alive and well.
So what are the message we go out to send so especially people up to now we not start for use facial masks is as government saying a mandatory for let people use facial masks in public spaces.
Now government don't make a law. Anybody within a public space, whether in a shop, on a supermarket, on a market, on a street outside people and they will not to you one day. If you not use mask, the law will take in cause. So if you not say you're not able for use mask, stay at home. Then at host. If you want to go market, send somebody will go able for use mask. When then at host, you can practice social distance and you not use the mask. But as long as you can street, definitely you're supposed to use mask.
Okay. Thank you very much.
You're welcome.